I'd like to welcome you to Infection Control Tips for Caregivers. This is one of the more important topics that I think we need to talk about, especially as we get closer to cold and flu season. And so one of the most important things we can do for ourselves is to make sure that we do good hand washing so that we can prevent the spread of bacteria and viruses, of course, to our clients and loved ones, but also so that we protect ourselves from possible bacteria and viruses that we could contract as a result of coming into contact with them in our environment. So we definitely want to think about using standard precautions. So you might have also heard of these as these tips as being our universal precautions. We want to make sure that we're using good alcohol-based hand sanitizers, which also dry out your hands. So you definitely want to have a good lotion. I have found that as I'm getting a little bit older, more mature here, my skin dries more than it did previously, especially my hands. And so I've had a real adventure trying to find a good lotion that works, that's not too greasy, but that also keeps my hands supple and not dry. And that's something that I think as healthcare providers or caring for a loved one, that we're all in that search of what's going to work best for you. But do know that your hand sanitizer is generally 99% effective at killing the bacteria or viruses that would be on your hands. Anytime anyone in my home has a cold, one of the first things we get is a baggie for your discarded tissues. And we also get a personal bottle of hand sanitizer. So in between, they can use that as well, disinfectants and other things too. We should also make sure that we wash hands when they're visibly soiled, and they should be washed with with soap and water. So hand sanitizer works really well. However, you will notice after a few usages of hand sanitizer that it is very important to go ahead and wash your hands in the sink, because that is the best way to really wash your hands to prevent the spread of infection. What you will notice is after maybe 3 or 4 uses of hand sanitizer, your hands start to feel kind of gritty, and that's that buildup of hand sanitizer that you need to definitely go and wash. We also need we also must make sure that we're using our gloves properly. So there's no special way to put gloves on. There is a way to take them off. And what I often see in practice with training caregivers and in other settings is that you may have someone have no problem putting the gloves on, but taking them off, they might as well not even wear the gloves because they're touching all over their hand. They're putting the glove, the soil glove, in their hand that doesn't have a glove on it any longer. So there's a great video on the Caregiver Support Services website, maybe 30 seconds, on how to properly remove your gloves.
Visit www.caregiversupportservices.com to learn more. Caregiver Support Services, where good caregivers become great.